Thank you for choosing Franciscan Scamp for your healthcare. Franciscan Scamp Healthcare, based on our health system's Christian heritage and our belief in human dignity, commits to put the needs of our patients first and to collaborate in improving the health of individuals and the communities we serve.
This video will give you a general idea of what you can expect of your experience at Franciscan Scamp. Your experience may differ slightly because each individual is different, and your doctor will tailor your instructions to suit your needs. Each surgery requires planning and time. As this video will give you a general idea of your responsibilities, you can find more detailed information in your Preparing for Your Surgery booklet. To begin, you'll want to make sure you have enough time off of work because your recovery is very important. You will want to bring a friend or family member along because you'll not be able to drive home after your surgery. If you'll be admitted as an inpatient staying overnight, it's a good idea to bring a toothbrush, toothpaste, comb, or any other toiletries you may want during your stay. You should talk to your doctor to plan approximately how long you'll be unable to work. All doctor's appointments should be kept. However, it's vital that you talk to your doctor as to which medicines you should take, if any. You'll also need to contact your insurance company to notify them about your upcoming surgery. On the day of your appointment, please have your insurance card along for your medical visit, and if you have any prescription drug insurance, be sure to bring that as well. It's important to bring these cards, otherwise you may not be able to get any medicines prescribed to you after your surgery. Before your scheduled surgery date is a good time to fill out your paperwork if you want to assign a healthcare power of attorney or fill out a living will. The day before your surgery, the pre-surgery nurse will call you between 9 a.m. and 5 p.m. If you won't be home during that time, you'll need to call the pre-surgery nurse at the hospital. The pre-surgery nurse will let you know an approximate time for your surgery, but it should be noted that due to the nature of a hospital, you may need to wait longer than expected. The pre-surgery nurse will also go over your medical history and the list of your medicines. It'll be much easier if you contact your doctor beforehand to discuss which medicines you should take the day before. Write down your medicines, dosage, and frequency in the chart located in your Preparing for Your Surgery booklet. The pre-surgery nurse will also discuss what you'll be responsible for the day before and the day of your surgery.
We ask that you do not eat solid foods after midnight. Drinking liquids may depend on the time of your surgery, but if there are changes, we will let you know. If these directions are not followed properly, your surgery may need to be canceled.
You will need to shower the night before and also the day of your surgery. Depending on the surgery, your doctor may recommend a cleaning solution to be used. You should not wear jewelry, makeup, perfume, lotions, or powders, and please leave valuables at home.
If you would become sick or injured prior to your surgery time, it is to your benefit to let us know or let your surgeon know prior to coming in.
The pre-surgery nurse will need to know if you have any allergies.
Please tell us if you've ever had any allergies to iodine, X-ray dye, latex, or any medications.
The Center for Advanced Medicine and Surgery building is just off Market Street in La Crosse. There's a patient drop-off and pickup area in the front, as well as a parking lot nearby. A map of the Franciscan Scamp campus and parking lots can be found in the back of your Preparing for Your Surgery booklet. There will be a patient registration desk and waiting area near the main entrance of the lobby. You will need to speak with registration and be given an identification band. They will verify your patient information such as phone number, address, and any emergency contact information at this time. If under 18 years old, we ask at least one parent or legal guardian be with you at all times. They should not leave the Center for Advanced Medicine and Surgery building. A nurse will come and escort you back to a room in the day surgery area. Family members may wait in the room with you. There's a surgery waiting room for family members down the hall from the registration desk. There's a small vending area open to family. Family should check in with the surgery waiting room volunteer so the surgical staff will know how to contact you throughout the day.
In the day surgery area, you will be asked to change into a hospital gown. You will also be given a patient belonging bag for you to put your clothing and shoes in. Family members will be asked to hang on to this bag while you are in surgery. Also in the day surgery area, you'll be visited by your surgeon who will mark your correct surgical site. At this time, you will be asked to confirm the correct surgical site marking.
The nurse will document your vital signs as well as complete any pre-surgery procedures, such as blood sugar tests or starting an IV. Prior to your surgery, you'll be taken to the pre-surgery holding area.
The anesthesiologist will talk to you about the type of anesthetic that will be used for your surgery. This could happen in the day surgery area or in the pre-holding area. While waiting in this area, we can answer any questions that you may have about your procedure before you enter the operating room.
The operating room provides a safe, sterile environment for your surgery.
Just prior to coming into the operating room, we'll double check that you understand the procedure we're doing, that we have the correct surgeon. We'll double check your name, your birth date, and any allergies you may have. You'll notice right away in the operating room that it's very chilly, that it's brightly lit. Once we get you over onto the operating room bed, we'll get you covered up with warm blankets.
After your surgery, you'll be taken to the post-anesthesia care unit, commonly referred to as the recovery room. Family will not be able to visit you while you're in the recovery room. However, they will be notified that you are there.
When you have safely recovered from anesthesia, you may return to your room. Your family members will be notified by the volunteer, and then you can meet up with them at that time.
As a friend or family member, it's understandable that you'd be concerned or would want to know the progress of the procedure. Any questions regarding the surgery would be best kept to ask the surgeon.
Before you leave the hospital, the nurse will teach you important things you need to know for you to recover fully from your surgery. One important thing to remember is to get up out of bed and start walking as soon as you are able. This helps to prevent blood clots. It's also important to be drinking lots of fluids. Water and decaffeinated liquids are your best choice. You may also be given a breathing device. Continue to use this as directed.
It may be disoriented to have so many people coming and going while you're recovering, but there are many people involved in making sure your surgery goes smoothly. Your doctor may give you or your family a prescription for medicine after your surgery. This prescription, along with any prescription drug insurance cards, must be with you when you pick up your medicine. It's important to know that you or your family will be responsible for picking up your medicine. There's a pharmacy on the Franciscan Skemp campus. Be sure to ask any questions you may have. You can help yourself by understanding what the doctor wants you to do. You're going to need help getting home, so it's a good idea to ask someone to pick you up. The road to recovery is a gradual one, but increase your activities and steadily get back to your daily routine. Let family and friends help you out. You're encouraged to go home and rest for at least 24 hours after your surgery.